Hi, I'm Catherine. I'm a student from China, and my topic is drug research. So I want to start with what is cancer. Under normal circumstances, the number and growth of all our cells is a highly controlled mechanism. But when the control signals in one of these cells goes wrong and its life cycle becomes disturbed, it divides and divides. It continues multiplying uncontrollably. And the result of this accumulation of abnormal cells is a mass of cells called a tumor. Benign tumors are non-cancerous and are rarely life-threatening. They do not spread or metastasize to other parts of the body. Malignant tumors are cancerous and can spread to other parts of the body. Cancer starts when one normal cell becomes cancerous. This happens when something disrupts the cell DNA, altering the instructional code that monitors the cell's life cycle. One or more of a variety of risk factors may contribute to this disruption. There are some common cancer risk factors: estrogen exposure, ionizing radiation, tobacco smoke, alcohol, and unhealthy diet, etc. There are a number of treatment options available for cancer. First, I want to talk about chemotherapy. Chemotherapy is the use of anti-cancer drugs. Anti-cancer drugs destroy cancer cells by stopping growth and multiplication at some point in their life cycles. Drugs may be administered intravenously into vein, orally by mouth, by injection into muscle, topically applied to the skin, or in other ways, depending on the drug and the type of cancer. Chemotherapy is often given in cycles of alternating treatment and rest periods. Second one is surgery. Surgery involves removal of the tumor. Sometimes surrounding tissue and lymph nodes are also removed. Surgery can be performed using conventional instruments or laser. Last one is hormone therapy. Hormone therapy is the use of hormones to change the way hormones in the body help cancers to grow. Most anti-cancer drugs act by inhibiting DNA synthesis or some other process in the cell growth cycle. Because anti-cancer drugs generally affect rapidly dividing cells, other non-cancerous cells will also be affected. The way in which the other cells are affected determines the side effects of the individual drugs. Other cells affected include blood cells, which fight infection, help the blood to clot, and carry oxygen to all parts of the body. When blood cells are affected, patients are more likely to get infections, may bruise or bleed easily, and may feel unusually weak and very tired. Rapidly dividing cells in hair roots and cells that line the digestive tract may also be affected. As a result, side effects may include loss of hair, poor appetite, nausea and vomiting, diarrhea, or mouth and lip sores. Many of these side effects can now be controlled. Side effects generally are short-term and gradually go away. Hair grows back, but it may be in different color and texture. Oftentimes, cancer occurs when several different pathways that regulate cell differentiations are disturbed. Autophagy plays an important role in cancer, both in protecting against cancer as well as potentially contributing to the growth of cancer. And that's where we have pros and cons. Autophagy can contribute to cancer by promoting survival of tumor cells that have been starved or that degrade apoptotic mediators through autophagy. In such cases, use of inhibitors of the late stages of autophagy, such as chloroquine, on the cells that use autophagy to survive, increase the number of cancer cells killed by anti-neoplastic drugs. The role of autophagy in cancer is one that has been highly researched and reviewed. There is evidence that emphasizes the role of autophagy both as tumor suppressor as well as a factor in tumor cell survival. However, recent research has been able to show that autophagy is more likely to be used as a tumor suppressor according to several models. And that's all. Thank you for watching.